Hi guys, it's Sheena from Teton Raptor Center and I'm here to give you all this week's patient update. Unfortunately, we just don't have the time to cover every single one of our birds in this week's video. So this week we're going to cover some of our newest cases and some of our most interesting birds that we're treating right now. Let's go ahead and get started. I want to kick things off by highlighting our most recent release. Here we have Golden Eagle 7-6 going back to the wild. This bird initially came in from Kemmerer, Wyoming and was struck by a vehicle. Luckily, she didn't have any broken bones when she came in, but she did have a lot of soft tissue damage and needed a lot of stitches. All of her wounds have since healed, and here she is flying back out in the wild. Moving right along to our current patients, here we have Swainson's Hawk 914, and this is actually one of our first adult birds that we've admitted this year as far as our Swainson's Hawks go. And this bird was hit by a car in Rigby, Idaho, and is dealing with a tailbone fracture. You can see that she's not quite standing, and we've got that towel called a donut to help keep her propped upright and support her a little bit. These types of fractures heal really well without any surgery. She will have to be on cage rest for a while, and then hopefully we'll be able to get her back out to the wild before her big migration down to South America. Next up is American Goshawk 914. This bird came in from Rigby, Idaho as well, and is actually dealing with a coracoid fracture on the left side of him. This is another fracture that heals really well without surgery, just needs a lot of cage rest, and luckily this bird does not need to go on any big migrations, so we don't have a time crunch with him. He's recovering in the ICU on pain medication and fluids and is doing well so far. Next up is Red-tailed Hawk 914, and this bird came in from Natrona, Wyoming. He actually had no physical abnormalities. However, when we did some blood work on him, we did notice a blood parasite called leukocytozoan. It is essentially from black flies, and this is something that we can treat with supportive care, and hopefully he'll start feeling better soon. Next up is Swainson's Hawk 9-7, and this bird came from Idaho Falls. He actually ended up having a lot of bruising that we saw on his chest when he came in, as well as a small scab, and we took some x-rays and noticed he had a fractured keel. It's just a small hairline fracture on his keel bone. This is something that will heal up really nicely with cage rest, so he's recovering in our ICU. Next up, we've got our tiny little northern saw-whet owl, and this bird came in on September 5th. He actually flew into a window here in Jackson and is dealing with a fractured coracoid, so that's a bone in the shoulder area. He also has a little bit of head trauma, but he seems to be doing well and is a very jumpy little guy. He tries to escape on us pretty much every day. Next up is Red-tailed Hawk 831, and this bird came in with a fractured ulna to the left wing. We just love when a bird does not need surgery for any broken bones, and this is another one of those cases. Though he has a fracture in that left wing, it's a really nice midline fracture, so if you're going to break your ulna, this is the way to do it. And so we just have to keep him in a wrap and keep him from flying. So he is in our ICU recovering, and then in about another 2 weeks or so, we'll be able to take the wrap off and let him begin flying again. Here we have Swainson's Hawk 822, and this bird initially came in because he was hit by a car. He had some road rash on his feet and some soft tissue damage on his knees, but nothing major. However, he recently, out in the flight barn one day, just started refusing to fly and would kind of sit on the ground and was really lethargic. So we grabbed him up for an exam and noticed that the inside of his mouth had this white lesion on the top of it. You can see it here in this photo. That is definitely not normal, and we were worried about something called trichomoniasis. If you're familiar with trichomoniasis, it is not anything close to what it is in humans. In humans, it's actually an STD, but in birds, it's a protozoal infection of the oral cavity as well as the GI. And so this is something that we can definitely treat in-house with some medication, so we're glad we caught it early. And if left untreated, these lesions can grow so large that they cut off the ability for a bird to swallow or breathe normally. So definitely glad we caught it early. Basically, this lesion, eventually over time, we should be able to slowly debride it and get those lesions out of his mouth. It's definitely not comfortable, and he's definitely not feeling great. So he has been moved back to our ICU and is on supplemental oxygen right now. Last but not least, for the birds that we're covering in this week's update is Swainson's Hawk 821, and this bird came in with a broken femur in his left leg. We did have to do surgery on him, so he currently has a metal pin that's going through his femur and out of his hip and his knee. And then 5 weeks after that surgery, we'll actually do a second surgery to remove all of the hardware that we've put in to allow it to heal. This bird is doing so well. He is standing on his own despite the orthopedic pins in there, and so he actually moved out of the ICU and he gets to be in a larger space. However, he will still require that second surgery to remove all of the hardware in just a week and a half. All right, that's all we've got for this week. Thank you guys so much for tuning in, and I hope you enjoyed learning more about our birds. Remember that if you want to do your part to help keep wild birds wild, you can check out our website at tetonraptorcenter.org and make a donation. There's also a link in the description below, so be sure to check it out there. Bye!